Have you ever experienced an onset of stress and anxiety from your visit to the hospital, clinic, or doctor's office? Your environment can have negative repercussions on your health outcomes. The white coat. It's not just a piece of clothing. If it's a fear of being diagnosed or of being ill or fear of the white coat itself, this phenomenon is called the white coat effect or white coat hypertension. This fear would provoke a state of stress which could negatively impact cognitive performance. Hello, my name is Ingrid. Welcome back to NeuroPsyQ. In today's video, we'll be discussing the neuroscience involved in the white coat effect and emerging alternative methods to overcome it. So let's get started. The white coat effect. It's real, common, and is defined as persistently elevated clinical blood pressure together with normal ambulatory blood pressure. That's the measurement from performing daily activities. For instance, if your healthcare provider observes you have higher blood pressure on the hypertension spectrum when measured in a clinical setting compared to when measured at home by yourself using an electronic monitoring device that does not require the presence of a professional, this phenomenon can be explained by the involvement of the white-coated health professional as well as the medical environment. This has become a problem since the number of people diagnosed with hypertension is increasing. This increase may be largely attributed to social or environmental factors, such as aging populations, air pollution, and exposure to various types of mental stress. Uncontrolled hypertension can also lead to other complications, including neurocognitive impairment. Yet only a few studies have examined the clinical significance of the white coat effect. Here, this video will provide an overview of what is known so far regarding white coat hypertension, cardiovascular risk, and how it also poses risk of cognitive impairment. The white coat effect in the brain is part of pathophysiological mechanisms of stress-related blood pressure elevation. The white coat effect is due to a neuroendocrine stress response reflex of the sympathetic nervous system occurring if an individual feels afraid or anxious. This could be because of a fear of being diagnosed with an illness, which is related to anxiety increasing blood pressure levels. Psychological stress is often induced by environmental changes, like seeing a healthcare professional wearing a white coat uniform, particularly in a medical environment. These environmental changes are perceived by the brain. Some are integrated in the neocortex, but others are sensed by the limbic system, which is involved in our behavioral and emotional responses in a situation of fight or flight. Research has investigated and found that the white coat effect has clinical significance. According to a study by Masanori Munakata, showed that men had positive correlation between blood pressure response to the doctor's visit and mental stress-induced increase in blood pressure. And it predicts left ventricle mass, which is an abnormal increased workload on the heart, whereas women did not. And a study by Mario et al. Found that older patients had white coat effect when attending a visit to the physician for suspected cognitive impairments. To expand on the relationship between the white coat effect and cognitive impairment, studies have shown in children on the spectrum of hypertension that adolescents with white coat hypertension had weaker vascular responsivity compared to healthy adolescents, suggesting that cerebrovascular effects may emerge early in the progression towards a hypertension diagnosis. Although there lacks mechanistic and definitive imaging studies, clinical evidence suggests that youth with hypertension may be at risk for brain target organ damage, and therefore neurocognitive deficits may be a clinical biomarker of hypertension. Studies have found that youth with elevated blood pressure had worse auditory attention and short-term memory functions when compared to their normotensive peers, along with lower than expected performance on verbal learning, attention, memory, visual construction, remembering visual information, and academic skills. Near majority of youth first diagnosed with white coat hypertension progress to hypertension diagnosis. A preventative measure to avoid progression to hypertension is the integration of neuropsychological support for youth with white coat effect to treat anxiety and the dysregulation of the sympathetic nervous system. This altogether may enhance their care. Now that we know that high blood pressure poses a major risk for cognitive decline, some white coat environments are likely to have a negative impact on cognitive performance, more specifically on the memory of older adults. Existing evidence shows that patients with hypertension performed worse than normotensive subjects across neuropsychological and cognitive function, including memory and attention. According to studies by Spinelli et al., Shahab and Abdullah, who showed cognitive function between subjects with normal blood pressure and white coat hypertension, found that white coat hypertension subjects showed lower cognitive performance on memory tests and higher levels of anxiety compared to controls. Therefore, it is reasonable to assume that treated hypertensives who exhibit a white coat effect may also feature more impaired cognitive performance. And according to the most widely accepted hypothesis, the relationship between hypertension and cognitive decline is mediated by cerebral vascular damage, such as white matter injuries, detectable as white matter hyperintensities. This is the disruption of white matter tracts that connect the frontal lobes to other cortical and subcortical structures, which may affect attention, executive functions, and speed processing in the brain. An exciting alternative method to assess cognitive performance is event-related potentials, ERP. A study by Cinquenetti et al. From the University La Sapienza investigated brain organ damage in 3 groups of elderly subjects with isolated systolic hypertension, white coat hypertension, and neurotensives to verify the clinical significance of white coat effect. The study first confirmed that patients with white coat hypertension had significantly higher clinical systolic blood pressure than the neurotensive group. Systolic blood pressure is more closely correlated with brain damage and cognitive impairment. They also performed mini mental state examination and recording of event-related potentials, ERP, often performed using electroencephalography, EEG, which is a sensitive and non-invasive method that allows us to record electrical activity induced in cortical neurons by stimuli to detect functional cerebral abnormalities, which could indicate an early decrease of cognitive ability. In this study, they recorded ERPs using the oddball paradigm. During the oddball paradigm, subjects are presented a random series of common and less common visual or auditory events. The less common events often elicit characteristic waveform reflexes from one's unconscious novelty-seeking system. The determination of the N200 waveform negative spike around 200 milliseconds is an index of early functional cognitive alterations, and the P300 waveform positive spike around 300 milliseconds is an index of clinical evident cognitive deficit. In this study, Cinquenetti et al. Did not observe significant difference between the groups regarding lag time of the P300 potential and the mini mental state examination scores. However, the lag time of the N200 wave showed significant difference between the neurotensive and isolated systolic hypertension patients, but no difference was detected by the controls and white coat hypertension or isolated systolic hypertension and white coat hypertension groups, meaning that the N200 lag time in white coat hypertension patients was intermediate between the 2 other groups, and this might be a result of increased blood pressure variability and may indicate an alteration in cerebral function. And this phenomenon may be considered as a predictive sign of future cognitive impairment. In summary, the white coat effect is real and common and is presented as higher blood pressure in clinical environments at the exposure of a healthcare professional wearing a white coat. It's associated with fear of illness and diagnosis. And if not managed better, it can be a predictive sign of future cognitive impairment. Though incorporating neuropsychological support may enhance the care of patients experiencing white coat effect. At this time, we can wonder why, since there are risks of cognitive impairment and worsening neurocognitive performance due to the white coat effect, then what is its purpose? Why is it being used? Well, the white coat has powerful symbolic function as a symbol of care for healthcare professionals. The white coat is associated with professionalism, competence, and knowledge, inviting a sense of trust and safety for the patient. Although it is also associated with authority and power, which can induce fear and submission. In surveys, patients, especially older adults, prefer healthcare professionals wear white coats to civilian clothes, perceiving them as competent but cold. And interestingly, the impact of the white coat is not limited to patients, since recent studies suggest that it could also impact the person wearing the coat as part of enclothed cognition theory, developed by Adam and Glinsky. Wearing particular clothing items leads to embodying that clothing and their symbolic meaning. Therefore, wearing the white coat may influence the people being interacted with and also one's own psychological processes. However, as a patient, if you'd still like to avoid feelings of anxiety and negative health-related outcomes associated with the white coat effect, then here are some tips suggested by the Cleveland Clinic to better manage the white coat effect, such as asking questions. If you bring a list of questions to your appointments, so you feel less anxious about forgetting to ask them, This will also help to develop a good relationship with your healthcare provider so you can talk with them with more ease. Taking your time, allowing extra time to get to your appointment so you feel less stress and avoid being rushed, as well as breathing. Practicing relaxation techniques like breathing exercises or meditation can help you to stay calm leading up to and during your appointment. Beyond these tips, fortunately, there are alternatives to the white coat effect in remote monitoring. There are currently emerging opportunities in neuroscience research and applications with brain wearables like consumer-grade EEG. EEG is a non-invasive neuroimaging technique to measure electrical activity, similar to recent breakthrough devices like the Apple Watch and Fitbit that have enabled heart rate monitoring and arrhythmia detection for the general public. With brain wearables, patients and the general public can use consumer-grade EEG devices to record and perform cognitive exercises, similar to meditation or the oddball paradigm, to monitor their brain activity from home and longitudinally. The cost-effectiveness and portability of these interventions can work to prioritize the patient quality of life and care, and at the same time empower them to take control of their health. Remote monitoring pilot studies aim to establish an effective alternative that could supplement the standard of hospital-based care. This would benefit the vulnerable and elderly patients where hospital care already faces risk of infection, long wait times, travel distances, in addition to the white coat effect. Patients could benefit from collecting data at home as they're performed in their familiar environment. And this could also provide the healthcare professionals with a more accurate picture of patients' health in between hospital visits. In the description box below, I will leave a link to a review outlining the opportunities and challenges of remote collection of electrophysiological data with brain wearables that mentions ERP collection with EEG and the oddball paradigm. Thank you for watching. Please feel free to check out these previous NeuropsyQ videos to learn more about EEG and brain wearables. If you found this video helpful, please like and share it. And until next time, please remember to click subscribe to keep up to date with our latest videos. Take care.